Shalom. Welcome to Fruitful Possession, a nonprofit organization. Welcome to today's class. My name is Sister Jemima from the House of Jacob. Today's class will cover what will happen immediately after you have your Israelite baby in a home setting. Like what kind of things will you see? What kind of things would you expect when you choose to go with a traditional midwife or a certified professional midwife to deliver your baby at home? So let's just say, you can have your baby anywhere in the home. The most I may make it where the baby comes out in a birth pool, or you may be in your bedroom and the baby comes out there. You deliver your Israelite baby there. It could happen in the living room. It just depends on where it happens. But I'm just going to say, I'm giving you an example. What if you have your baby, you started out in the birth pool as a comfort measure. You got to sit in some warm water for a while. It really helped with the labor, progressing with the labor. You sat on a birth ball for a little while, a peanut ball. Then you walked around a little bit, with your husband or, Israelite family member. And, you went in the bathroom, you sat on the stool for a little while. And when you wind up going to the bedroom, that's where the baby came out. So when you lay down, you had, of course, you had your mattress covered with some protective liner. And then you had some bed chucks, things like that. And it's time for the baby to come out. The contractions are really, really close together now, and the baby's going to be delivered any moment. So what you will see, pretty much is you may have a crock pot. The midwife team that comes over, that you selected, will come over with their supplies, and it takes about 15-20 minutes or so to pretty much set up everything. They'll have a crock pot with some clean rags in it and hot water, right? And that's just to help clean you up after you have your baby. The wipe down there. They may use some olive oil before the baby comes out in some hot water that's tolerable to you in your vaginal area, so just to get it prepped to help reduce tears if a tear could be possible. And then it's also used to help clean you up after you have your Israelite baby. So they'll set up everything pretty much, and then they'll have all the supplies. They'll ask you where your birth kit is. And other things. You may want peroxide there to help clean up the blood and everything like that. And you have tons and tons of bed chucks. And I'll show you what a bed chuck looks like. You've seen them. They have different quality bed chucks. It's just, like this. And you'll have a whole bunch of these on your bed, even though you lined your bed, with a protective liner. You have these on top as well, because you're going to need that when the baby comes out, if you're delivering on the bed or on the couch. So they can kind of grab it. They'll have like a trash bag for soiled they'll have a trash bag for trash as things go on, as the delivery progresses. They're cleaning up afterwards. And then they'll have a separate bag for laundry because that's for towels that they'll use and rags, things like that that need to be washed. Anything they had to use for the baby that was not disposable. They'll have like two bags and they'll clean up for you too, kind of straighten up for you afterwards, try to offer you some food. So let's talk about the actual birth itself. So now let's say you're pushing the baby out and the baby comes out, right? And the placenta is still inside, of course, because the baby will come out first. And now you delivered your Israelite baby on the bed, for example, and you have a whole bunch of bed chucks underneath you. And so the baby is still, the umbilical cord is still attached to the baby, and and the placenta is still inside of you, immediately after you have your baby. So what usually will happen is that the midwife, the certified professional midwife or traditional midwife that's delivering your baby at home, will just take your baby, right, and bring it right back up to you in your bedroom, in the comfort of your own home, whether you live in an apartment or a house or a townhouse. You don't have to deal with certain things. You can control the environment. All praise to the Most High, you and your husband. And it's much more private. You decide how many people, you and your husband decide how many people you want in there. And so the baby is brought immediately to the mother to breastfeed right away. And that's encouraging the mother to breastfeed and put the baby belly to belly, right? You hold your baby belly to belly.
Breastfeeding patterns. In the first weeks, breastfeeding can take up a lot of your time. But as your baby gets better at it, it will take less time. You can also expect some clustered feedings. This is when he nurses frequently for several feedings and then takes a break before feeding again. Your baby will also have days when he eats more often. This usually lasts between 1 and 4 days and is a natural way of building your milk supply to meet his growing needs. The more you breastfeed, the more milk your body makes. So it's important to feed your baby often from both of your breasts. Offer both breasts throughout the day. Let your baby feed from the first breast as long as he keeps sucking and swallowing. If you need to remove your baby from your breast, gently break the suction by placing a clean finger in the corner of his mouth and over your nipple. Try to burp your baby. He may not need to. Offer the second breast, but don't worry if he doesn't take it. At the next feeding, start on the side that wasn't drained as much as the previous feeding to encourage healthy milk supply. Burping your baby. Burp your baby after nursing to get rid of any gas he may have swallowed. Burping is a great way for your husband to help out and spend time with the baby during feedings. Don't worry if nothing happens. Breastfed babies don't always need to be burped. Let's talk about how to burp your baby. Put a cloth under his chin in case of spit-ups. Hold him while he's sitting up in your lap. Support his chest and chin with one hand and gently pat his back with the other. Once your baby has better head and neck control, you can hold him against your chest with his chin on your shoulder. Avoid pacifiers. Early use of pacifiers can make it harder for your baby to breastfeed successfully and could reduce your milk supply. That's why it's best to stay away from them, unless there is a medical reason for it. Thank you for listening to this Fruitful Possession Health Tip Moment.
I'll show you what belly to belly is. So this is just a mannequin, but you take the baby, right? This is just a mannequin, but this is still an example of it. You take the baby and you put it on a breast, belly to belly, like this, right? And you make sure it's a good latch. You'll know if it's a good latch, as you can see by the image that you see on the screen here. That's a picture of a good latch. But you want to make sure the baby's belly is matching your belly, is lined up with your belly, and you know you want to breastfeed that way. So that's what you'll see. And the midwife will do this to encourage breastfeeding. She'll look at it to make sure it's a good latch. And not only is this good to promote breastfeeding, after you have your baby in the postpartum period, it also helps to release the placenta that's still inside of you. So she won't cut the umbilical cord within the first couple of minutes. A midwife will usually wait at home, maybe a half an hour at the shortest, to up to an hour. It just depends on how long. She might even be more patient and say, okay, I'll wait 2 hours. Make sure it comes out on its own. But a lot of them will wait a half an hour, 45 minutes into it. Make sure that Israelite baby gets all the nutrients that they need out of the placenta. You always hear about stem cells, things like that. And it's very good for the baby's system as well. And so, let's see. So once the baby is breastfeeding at the breast and the placenta is still connected, about 45 minutes or so after that, if the placenta hasn't come out, you might see some repositioning, just to see if the placenta will come out. They may give a natural, lawful, you check out what they're going to give you, but a lawful, natural herb that the Most High gives you. It helps to release the placenta, but you can check the ingredients out on your own, and you want to make sure that it's okay for your body, but it's like a natural herb. And usually it's lawful, so you want to just make sure you check this to see what's in it first. And then when it's time to birth the actual placenta, well, let's go back a step. When after about 45 minutes or so, the midwife will cut the umbilical cord, even when the placenta hasn't come out yet. They'll cut the placenta, the umbilical cord. I'm sorry, the umbilical cord, not the placenta. The placenta is still inside of you. The umbilical cord is hanging out, and so after about 45 minutes or so, she'll cut the umbilical cord. Then she might give it a little while longer if the placenta hasn't come out. She'll, kind of help to try to see what's going on inside to make sure. But usually they deliver within 20 minutes or so. Sometimes they may take 45 minutes, maybe an hour or two. It just depends on what's going on. But a good way to help promote the release of the placenta is to have the Israelite baby breastfeed right away. And it just does something with the hormones, and it just makes it kind of come out. Sometimes the placenta has come out, but it just needs a little help coming out. And you want to make sure that you have a good midwife that will know what to do when that time comes. And so, let's see, once they cut the placenta, and then the placenta is delivered, because you'll feel a few cramps after you have your baby with you. You feel a few cramps, and then the placenta comes out. And after the placenta comes out, it's kind of good for the midwife to massage the abdominal area lightly for about 5 minutes afterwards, because it helps to reduce a lot of the bleeding after that. And of course, you can go on our Pinterest website. There's just a lot of information that we were able to grab and post to the site that may be helpful for you. Of course, you want to check it to make sure it's lawful, but you may see things like raspberry tea, or alfalfa leaves, or nettle leaf tea is very good for you. You can also take an organic version of that. You want to check, of course, with your doctor, right, your midwife, and you can also read it on your own. But they are very good. Nettles tea and alfalfa, for example, and raspberry tea. They are very helpful, and they are lawful as well. They're very helpful in reducing hemorrhaging. A lot of our Israelite women have heavy bleeding, things like that. So you want to find out some natural ways that you can help significantly reduce that risk. And alfalfa tea, if you like raspberry leaf tea, they sell that in the supermarket. You can drink that. Um, you know, you can drink that. I would suggest you as well, if you can, if you don't really know anyone that knows a lot about natural lawful herbs that you can take. You can read about some. You can read about in a lot of books. I read one from Midwifery Today. It's a magazine, and it's called the Hemorrhaging Book. I think it's called the Hemorrhaging Book. I'm going to show this to you. Yeah, the hemorrhaging. It's called the Hemorrhage Handbook, and it didn't cost much, and it's very helpful. And they talk about things, of course, but when it comes to the actual natural herbs, they'll break down why is it good to take alfalfa, and then you check it out too. They'll list contraindications. Like for example, on this page, it talks about the benefits of raspberry leaf tea, and you'll see about it. You'll read about it. It'll tell you things like that, how often to take it, things like that. So it's very good to read about that. It'll also talk about the amazing alfalfa nettles leaf as well. So you want to check out that as well. They do mention that you have to be careful as far as like, uh, I think it's alfalfa sprouts. You don't want to take that. You want to just take the leaves. So you want to read about that. And it's very helpful. A lot of people are taking this. It's very helpful. The Most High created natural herbs that are lawful. You just have to check it out to see which ones are good for you. So let's see. So they cut the umbilical cord. The baby is with the mother. And then now it's time for the newborn screening test, right? So what happens is after the umbilical cord has been cut, sometimes the placenta is still inside, but it's time to examine the baby, the newborn exam. It's called a newborn exam. So let's pretend this baby was just taken away from the mother, like the umbilical cord was cut from the baby, right? So now they cut the umbilical cord. They're getting the the cord ready for the child. You know, they tying it up, they put a clamp on it, and then they're getting it ready, right? So that in about a week or a couple of days, it'll fall off and it'll be the natural navel there, because you want to make sure you keep that area open, and it'll speed up it falling off, and then the navel will be normal. So she'll get the umbilical cord cut, and she'll get that ready, right? And then now it's time to examine the baby. So she's going to do this. I'm going to show you. Be right back. I'm going to look for I have a measuring tape in here. You'll see the midwife is something like this, a real small bag. They have different styles. It may not be always open. You may like the one that's open where you can see everything. And I'm going to look for my measuring tape. So when the baby is first born, it depends on how many weeks the baby was. If the baby was healthy, of course, born at home, but just a little early, you may see a whole lot of vernix all over the baby when the baby first comes out. I forgot to mention that. So let me just read that first to you about the vernix. You know, it's like this, it looks like a cheesy substance all over the baby. You may not see it on some babies, but you might see it on others. And I'm going to tell you what that means. Okay, so it says, what is vernix and why is it important? So you may see it all over the baby when the baby comes out. So, my baby's healthy, but I just wonder what that stuff was. And why is it on there? So it says, it's this coating that protects an unborn baby's skin from fluids that are in the body. It protects it, and it helps to make the skin nice and soft and not wrinkle when the baby's inside the mother's womb. So when you see the baby come out, You may see a little bit, or you might see the baby covered with a whole bunch of it on it. It just means if it was really covered with it, the baby could have stayed in the mother's womb a little longer, but everything was healthy. The lungs were developed well, everything, all the organs were developed well, full term, and the skin was intact. Everything was great, and the only thing that the midwife would have to do is just clean it off the baby. So that's pretty much it. And so let me get the tape, because what happens is once the baby is taken out of the mother and the midwife cuts the umbilical cord. Well, actually, usually it's the father or someone in the family, but if they don't do it, the midwife will cut it. She'll just like get it ready with a clamp, and just let the father know where to cut the cord. And then she gets it ready after that. She gets it prepared for healing after that. So I'm going to get my measuring tape out, because I'm going to show you what they do to a newborn when they come out. They're going to do certain things. And I have it. All right. So you'll see a midwife with like a whole bunch of supplies, but then she's got her ready to go bag with certain things in it. She may have herbal tinctures in there. She may have a stethoscope to listen to the baby's heart. Right? This is a stethoscope. She may have a pediatric version, but she can use the adult version on the baby as well. So what she'll do, it pretty much is, let's put the baby back in the scale for one moment. And then usually what happens is they put the baby on a clean surface, right? And then you take the baby and they place the baby down right away. So the baby was just born. She's taking the baby. She gave the mother and the child about 45 minutes to bond, breastfeed. But now it's time to do the newborn exam, because it's that time, right? So she's gonna look at the baby. She's gonna look at the skin. They're gonna clean the baby off, of course, right? They're gonna clean the baby off. They're not gonna clean the baby off immediately after the baby's born, because they want the mother to see the baby, the father to see the baby. They want the parents, the husband and wife, to bond with their baby. And then about after 45 minutes, that's when they kind of see if they can cut the cord. And so then they usually have something to measure the baby with, in inches, right? And when they measure, what they do is when they look at the baby's skin to make sure everything is intact, they're doing like an Apgar scoring test, and we'll talk about that as well. I'm going to read that to you, but I'm just going to show you what happens immediately when they do the newborn exam. So they're going to measure the baby's head, right? You're going to gently measure the baby's head. Gently measure the baby's head. All right? So this baby's head is 14 inches. All right? So they're going to measure the baby's head. Then they're going to go right to the chest. All right? They're going to be very gentle with the baby. So the next thing they're going to do is measure the baby's chest. All right? Okay. So this one is 14. So the head is measuring the width of the chest as well. And that's usually what you see in a healthy baby. The head circumference is going to be the same as the chest. And then what they're going to do is they're going to have a pen with them. It may not be in this exact order, but they're going to measure the length of the baby. They want to say, how long are you? So they want to know, what's the size of your head? What's the size of the baby? What's the size of the baby's skull? What's the size of the chest area, the rib cage area? How long is the baby? How long is the baby? All right. So they're going to take the tape. They're going to take a pen and mark it from the head. You see a pen right here, right in front of you. The mother and father will see it right in front of them, which is great. It's very personal. It feels great to do it at home. They can rest. They don't have to travel from a hospital to back home and then try to rush there to have the baby in a hospital setting, because a lot of mothers will, couples, a lot of husbands and wives, they will try to rush to get to the hospital with the second and third, fourth, and they don't make it. They wind up having the baby at the house a lot of times. It just happens that way. The father delivers the baby, and it's really beautiful. Praise the Most High. So they take pin and measure it. They put a mark right here at the top of the head, and then they'll. Some most of the time the baby's feet are feet are um, bent, right? Because they just came out. They were in the mother's womb, nice and comfy, cozy, and now they're out. So you kind of stretch the leg out a little bit to make sure it lands on the front, and you mark it. And then you measure the area. So let's see how much this mannequin baby, let's see how long the baby is. So usually what I do is to pull the leg out to make sure that's really how long the baby is. Pull one leg out. And you hold the tape down. This baby is about 18 inches long. But this is a mannequin, of course, but about 18 inches long. All right? Then they're checking the skin. They're going to be looking in the mouth. This is another thing to remember. The baby was inside the mother for about 9 to 10 months, right? So, you know, they were inside. So you need to check for the very first time. Is there anything in the baby's mouth? Well, if it's a boy or a girl, you have to look in all openings. If it's a girl, you have to look in her anus, her rectum. You have to look in her vaginal area to make sure everything is normal. You have to look in the ears. The boys, too, you want to make sure there's no vernix in the ear. There's just nothing in there because they had to go through a birth canal. You want to make sure, is there anything in their mouth? How are their eyes looking? And then the boys, you want to make sure that both testicles come down. Is there anything in their rectum as well? So you're going to be looking as well on both Israelite boys and Israelite girls. Make sure everything's normal for the first time. You're also going to look at the quality of the skin. You'll see a midwife go like this with their finger. They're checking, you know, the baby's response, the reflexes, things like that. And you'll see the toes kind of grab like this when you go like this. And that's normal. That means that's normal. Right? And if the baby's crying, of course, that's wonderful. That means the baby's healthy, it's crying, it's alert as well. And then now, let's say they write this down. They write down the size of the head. They write down, okay, color is fine. The chest was this. The length was this. Good reflexes. Not much vernix. If there's any vernix that we talked about, the baby's cleaned off, you know, afterwards. They clean here. Usually there might be some in the crevices. It may not be anything all over the baby. It might be just a little bit here. It might be some behind the ears. And you wipe it off with baby wipes as well. So let's say now it's time to weigh the baby. This is all done immediately in front of you. Remember, if you're on a bed, you're going to see the midwife doing all this and her team all in front of you on the bed. So, and before this, they're going to do this as well. After they do that, they're going to be checking the heart rate as well. It's not fetal heart tones anymore because the baby has been born, but they're going to check the heart as well. They're going to do things like this. They're going to check the heart. They're going to check the stethoscope, make sure they can hear it. They're going to press it down gently on the baby so they can hear good heartbeat. And they say, okay, the baby's heartbeat is really good. So they're going to take that away. They're going to turn the baby over as well. They're going to check the baby's spine. So you're going to gently turn the baby around. That's what you're going to see as well. You're going to go like that, pretty much. And then they're going to be checking the alignment of the spine. You know, for things like, is there any lordosis? You know, things like that. Is it irregular curvature on the spine? So in this case, no, this is normal. This is a normal, healthy baby. Everything is great. The skin is great. The baby's crying. They didn't see any meconium. And you may have heard of meconium. It's like the first black stool that comes out. But let me read about what it is, meconium. So you can say, well, what is meconium? Why do we hear about that? Let's see. Meconium. I'm going to read that to you. Meconium. You'll see some babies pooping it out as you are as the midwife is doing a fetal exam, or when you're holding your baby. So, he or she is actually pooping right on me. That's good. And then they wipe it. The team will wipe it off for you. The team will wipe it off for you. It's a black stool. It's sticky. It'll go away in a couple of days. Um, and so um, that's pretty much it. So I'm gonna check that for you. But you probably see the definition on the screen, which is great. Meconium is like a black sticky stool. It comes out. It's coming from the digestive system. But I like to read what it is. A dark green substance forming the first feces of a newborn infant. It's not dangerous. It's very normal. Some babies just poop a little bit, right, when they're born, or some don't even poop any at all at birth. But the first diaper you put on them, they start pooping. So that's very normal. And you just clean it up, clean it up. And so now let's say, okay, now we want to weigh the baby. The midwife examined the baby. The parents are right there. The father and mother are right there looking at everything. They're happy they had their baby at home. They got the controlling environment. Now it's time to weigh the baby. So this is a scale, but not all midwives carry this with them. Sometimes they may have like this cloth thing they put in, and they have this scale they hold up and they put the baby on. Depends on how much equipment they're bringing in the house, who's bringing what. But I like to show you what a scale looks like, you know. And this one's kind of nice because it comes off like that, so as your baby begins to start walking, you can have them stand on that as well when they're a toddler, which is great. But this is when you're going to weigh a newborn, all right? So you're going to take they're going to take your Israelite newborn baby, right? And they're going to do all of this right in front of you, right on the bed. If you have your baby on the bed, you have it in the birth pool. You're coming out of the birth pool after you deliver your baby, so you're probably going to go to a couch. It depends on where did you put your birth pool, all right? And and then they do that as well. They still will do the same thing. They'll cut the umbilical cord and everything on the couch. It just depends on where you have it because you don't want to walk around after you have your baby. Pretty much, you want to relax. You want to take it easy for like the first 3 weeks or so. You don't want to do a lot of activities. You need support. You can't make all the meals and stuff. So you want to plan those things ahead of time and find out who's going to be your Israelite support team when that time comes. Because you need help. You want to learn how to wear your baby in a baby sling too, after you have your baby, so you can have your arms free no matter where you go, in your home, your car, to the supermarket, when you're walking somewhere with your baby, you're going to the movies. You got your arms free, and your baby's like, oh, I just love mommy. She's right there. Your son is so happy. He's with his mother, or your daughter's so happy that she's sitting right under you. And you will be a beautiful light to others as well. So, okay, so now it's time to weigh the baby. This is all happening in front of you, and it doesn't take a long time. I'm slowing down so you can kind of picture it. And you can always leave us comments on our website. We would love to read them if you have any questions, something I didn't go over, and you have a question about these procedures or thinking about a home birth, you're more than welcome to contact us, send a comment as well. So, okay, now the baby's being weighed. So we're going to put the baby in here. We're going to make sure the surface is clean before we put the baby in there, right? And so now, okay, you press the button on the machine. This is what your midwife is using. You make sure your hands are clean when you're touching the baby. I like to put gloves on. I'm not a midwife. I'm just educating you on that. And these are some things you would need to know. And so then the baby is 8 pounds. Exactly. Wow. That is a healthy baby. So we got to measure the head to see how large the skull is, the chest area, the length of the baby as well. So now we did all that. We recorded all that information. So now we put the baby back on here. And now we're going to clean the baby. We're going to really clean it. So let's clean it. Need some more cleaning. Then we're going to give it to the mother. You might see multiple times the baby's cleaned because sometimes when the baby is breastfeeding, when the baby comes right out and you bring the baby immediately to the mother, the Israelite baby, boy or girl, may, have a bowel movement, pooping out that meconium. So that's normal. That's very normal. The mother's not even paying attention. And then a little while later, the placenta will come out. So let's pretend now, after we did all the examination of the baby, now the baby is going back with the mother. Right? And so it just depends. Sometimes The mother needs a moment. It depends on the situation. The father may say, "Hey, I want to hold my baby right now because the placenta is coming out, and now the mother is experiencing more labor pain. She's getting more contractions. It's not as strong as the contractions are not as strong as when the baby came out, but they're coming again. They're coming again. So now the placenta is coming out. And so, you might have, she may be like, oh, I can't hold my baby because the contractions are coming. So just think about it. When the baby was inside of the mother, right, she wasn't holding the baby. So now the contractions are coming out. So sometimes a mother may not be able to hold the baby and have the contractions at the same time. It just depends. So let's say that placenta came out now. Now it came out. You'll see some blood when the placenta is coming out, especially when the placenta comes out. It could be about 2 cups of blood, and that's why it's really good. So I put the baby back on the scale. That's why it's good to have, even though you may put a liner on your bed or on your couch, right, or wherever you're having the baby, it's good to have these disposable bed chucks, a whole bunch of them around. Keep them in the house because what happens is when the blood fills on there and the placenta comes out, they usually wrap the placenta up, right, like that, separately, and then they're going to check it out later. They're going to they're going to look at the quality of the veins. They're going to look at the quality of the clotting. They just want to see how healthy the placenta is. A lot of midwives like to look at them. And then, it depends on what you want to do. You can discard it and then throw it away. They usually just throw it away for you. So, and then like a little while after that, it's not going to be that day. Maybe the 3 days later, up to 3 days later, the midwife will come back for a home visit because you can't come to the midwife's office. Midwives that visit families in the community, they have their own office usually in their home, which is nice. And when you come visit a midwife, you're coming in their living room. Then they'll take you to a natural, just a bedroom or some very comfortable, welcoming room where they measure the length of the baby, check your blood pressure when you're pregnant, and then they'll check the fetal heart tones, things like that, and then just see how you're eating, things like that. We'll talk about that. I'm sure you've heard about things like this, but I'm going to go over that in another class as well. So I hope you enjoyed today's class. I wanted to share this one thing with you before we go. The 3-day postpartum visit at your home was really nice. Is they'll usually take the baby and they'll check on the baby and check to see how the navel is healing, see how you're doing, and just make sure you're breastfeeding okay. And that's pretty much it. And then they may visit you 1 or 2 more times. And then you come there for a follow-up visit at the midwife's house and just share your experience. And then you're invited to come to some sort of gathering with other Israelite families that birthed or are getting ready to birth, so you can share your stories and how your home birth, your planned home birth was. How did it turn out for you? So with that, I'd like to say all praise to the Most High. And I this is another Titus 2, 3-5 class about, of course, things that have to do with childbirth and education as well. So the aged women likewise, that they be in behavior as become with holiness, not false accusers, not getting too much wine, teachers of good things, that they may teach the young women to be sober, to love their husbands, to love their children, to be discreet, chaste, keepers at home, good, obedient to their own husbands, that the word of God be not blasphemed. So that was Titus 2, 3-5, and I just wanted to share that with you. And with that, I'd like to say all praise to the Most High, and Christ blessed. Shalom. Thank you.